Good afternoon, everybody. Very excited to welcome everybody to our panel today. Very special welcome to our panelists and to everyone that is joining us here today. So this month, we are recognizing National Recovery Month, a time to celebrate the millions of people in recovery and to help guide those who are still needing assistance by raising awareness of what it means to be in recovery and how anyone can access critical supports and services. My name is Greg Lee. I will be moderating the panel discussion today. I work in the Office of Behavioral Health at Cook County Health. I'm a licensed clinical social worker and have worked for many years in community mental health services and substance use treatment and support services, as well as in Medicaid managed care, both here in Illinois as well as nationally. The Office of Behavioral Health, established in 2023, was established because Cook County leadership recognizes and prioritizes the behavioral health needs of all Cook County residents, particularly those from historically marginalized and underserved populations. The Office of Behavioral Health's goal is to be a regional convener of county residents, providers of care, community-based organizations, government agencies, and other stakeholders like you to identify opportunities to grow and enhance access to quality behavioral health care for all residents of Cook County. At Cook County Health, we are extremely proud of the care and services we provide through our hospitals and community clinics when it comes to helping people wherever they are at in the recovery journey. We recognize that each person is unique. That means that here at Cook County Health, we work to provide treatment and support services that are individualized to meet the needs of that person's own recovery process. For more information about that, visit cookcountyhealth.org/MAT. That's cookcountyhealth.org/MAT to get started. I'm very grateful to everyone that has joined us here today for this very important discussion, including a few of our excellent community partners on this panel. Before we get started with the questions and discussion, if everybody would please take a minute to briefly introduce themselves and describe the work you are doing in relation to substance use disorder recovery support and treatment services. So I'm going to start with you, Jim Scarpace.
Thanks, Greg, and good afternoon, everyone. Thanks for having me today. My name is Jim Scarpace. I'm the Community Division President for Gateway Foundation. I've been a licensed clinical professional counselor for 27 years, and in my president role here at Gateway, I oversee our residential, outpatient, and recovery home programs across the state of Illinois. Just a little bit about Gateway. We've been in operation for about 57 years now, and over that time have helped more than 1 million patients achieve a life of recovery, as well as we serve about 30,000 individuals a year, focusing on helping them successfully complete treatment and continuing their recovery journey. So I'm happy to be here, and thanks for having me.
Thank you. Dr. Burkhead.
Hi, I'm Andrew Burkhead. I'm a family physician with Cook County Health, also practicing addiction medicine. I oversee our Bridge Clinic, which is our rapid access to medications for opioid use disorders, and we serve as a connection both to our hospital and clinic system, as well as to our community partners where it's appropriate. I also am involved in training of providers across the spectrum of care here at Cook County Health, trying to make it's so that every provider is an entry point into recovery. We also provide services such, aside from medications and counseling and referrals, we also have behavioral health services, Narcan, drug checking, harm reduction methods, whatever you can name, and I'm happy to continue to go into depth about it.
Thank you very much. And Nathan Kalbakota.
Thank you, Greg. Hi, everyone. Nice to be here with you all. I'm Nathan Kalbakota. I'm a licensed clinical social worker. I am also the Vice President of Programs at A Safe Haven. I oversee all of our transitional and emergency housing programs. We also have a significant recovery home presence with buildings in Chicago that are devoted exclusively to recovery homes. And we have an IOP and OP outpatient treatment here at our main facility at Roosevelt. And soon we will be rolling out a level 3.5 residential treatment offering as well, which is very exciting. So great to be here with you all.
fantastic. I appreciate everybody sharing. We have quite a diversity of individuals, providers, and organizations that are represented here. It should be a very exciting discussion. And I really appreciate that you're sharing about your organization and the work that you're doing in your communities. So, Dr. Burkhead, I'd like to start with you. You mentioned you could go on and on about the different things that are provided through Cook County Health. Can you talk a little bit more about the work that Cook County Health is doing to provide residents with access to recovery supports? You are still on mute, Dr. Burkhead.
Thank you. I appreciate it. So as I was mentioning before, we have many different facets which we approach recovery and access to recovery support. One is through clinical, through clinics and resources, and the other is through education and expanding the access that is typically provided for patients. So what we're working on is making sure that each and every one of our trainees here, so resident physicians, has access to learning and training on substance use disorder, so that they can see a patient and in that same visit initiate treatment for substance use disorders. So we're trying to make it just so any contact with our health system can be an entryway into treatment. We have our Bridge Clinic, which is our standalone point of access into our system, where we take patients that are referred from outside facilities, from emergency rooms, hospitals or clinics across the county, and we provide them with same-day access to physician care for addiction, where they may just receive a consult for some information, or we could even start them on treatment for addiction remotely via telehealth. It's very important that we are, part of what we're doing also is making sure that we are interfacing with our community partners. So we do work with a few of our members here that you're seeing in their organizations. We also work with the Cook County Jail to make sure that there's continuity of care from the patients that are released once we're there. We've also started a methadone program at one of our clinics in Austin, which is a great next step in what we're doing, in addition to our prescribing of buprenorphine or naltrexone or whatever other products it is that our patients may be using to help with their recovery. And please let me know if I'm missing anything. Again, I keep going on and on, but you know as well. But yeah, in terms of providing access, we just need to make sure that every provider here has some experience with recovery and addiction, so that we can make the entry as easy as possible.
Great. Thank you so much for sharing that information, and really appreciate the work that the team at Cook County Health is doing to support all the residents of Cook County as they seek care and support during their recovery journey. And I know we're going to touch on a lot of the different things that you just talked about. There's so many different ways that we can go here. So I'm excited to let's open up the questions to the entire panel. And I think I'll initially direct this first question to somebody, but please, everybody feel free to jump in to answer and provide information that help address any of the questions. So Jim, I'm going to start with you actually. How do you and your teams view recovery, and what does recovery look like and mean to you specifically?
So that's a great question, Greg. I think the first thing I want to say is that recovery is so much more than sobriety. And, when we hear that term recovery, sometimes it's synonymous with people think sobriety. And although sobriety is a big part of the recovery process, recovery is so much more than that. It's about connection. It's about support. It's about knowledge. A lot of patients who are earlier in their recovery journey don't understand that this is an illness, a disease that affects the brain. When we talk about substance use disorder, when we talk about mental health disorders, when we talk about addiction. And so they come in defeated. They come in believing that, this is who they are and who they're always going to be. So part of it is just also about hope, about helping people really understand what this illness is and what it isn't. We've known since the 1950s this is a disease of the brain, yet here we are in 2025, and there's still so much stigma that surrounds the concepts of addiction. So at Gateway Foundation, we're really focused on helping people develop both skills and strategies to manage their substance use disorder, to really be able to build up functioning not only around managing their substance use disorder, but in their primary life domains, including housing and support. A lot of individuals don't have that primary life domain in a manageable state. So we want to really help build that. So for example, in Cook County, we have our Chicago Independence site that not only has residential and detox and outpatient programs, but a 20-bed women's recovery home. Off of Kedzie in the city, we also have a 72-bed men's recovery home. We really want to help people build up the supports and the systems they need to not only continue on their recovery journey, but really understand that who they want to be, who they should be, who they could be, is part of that recovery process. So that's our goal as we help people move forward, not only in treatment, but in their recovery journey.
Thank you so much. Dr. Burkhead or Nitin, are there anything you'd like to add to that?
Yeah, when you mentioned it sort of going but beyond abstinence, that's something I really like to hear, and I think just a huge misconception in the greater community, but also with people that would benefit from a lot of the services that we're able to provide. I think a lot of times, a lot of my patients believe that a relapse or any use could be a failure or a reason to leave recovery, and that's one of the very first things that I talk about with them is that success isn't necessarily measured by how long you can stay off of a substance, but sort of the whole picture, the physical, emotional, social, spiritual, all of those dimensions that we got. And I think maybe a greater measure might be the degree to which a person may be, honest with themselves. I think that may be one of the first steps, it is one of the first steps in engaging in recovery. And if we can sort of just get that idea that abstinence is the most important part out of people's heads, I think we may see a lot more patience and a lot more success.
If I could just add one thing to what Dr. Burke had mentioned around returning to use, or what historically in the past may have been called relapse. A lot of the research now even suggests that in that first 90 days after someone is attempting to stop using a substance, that there will be periods of time where they may return to use and have those struggles. And that's really part of the recovery process, where historically, as Dr. Burkhead had mentioned, it was looked at in the past as a failure or as a relapse or as a problem, when now we recognize that as part of that healing process, and as the brain starts to try to develop a plan internally to get back to baseline, that's a part of that recovery journey.
Yeah, I'd just like to add that, recognizing what might seem to be setbacks, looking at those as learning, data points in a process, is just also to really focus on celebrating small wins. We can look at wins in an order of magnitude that we define. So making sure to acknowledge that there are wins in a number of areas as people make that progress and have reason to stay committed.
That's so interesting to hear, and I appreciate you both sharing your perspective. We think about a step back as actually an opportunity to be successful, and I think just knowing that, whether you're somebody who provides services, somebody who's seeking help, no matter where you're at, which really kind of leads into the next question in terms of, you've all described such a variety of services that are available and supports that are available in different ways. What would you say are some of the biggest challenges a person may face when starting their recovery journey, and how can healthcare providers and others in this space help individuals navigate some of those barriers.
Okay, can I take a second to talk about, and I talk about this with my patients usually at the first or second visit when I talk to them, but shame. It's just as one of those emotions that can be incredibly difficult to overcome. There are many challenges to getting for people to enter into recovery or to stay in recovery. But I find that as part of that return to use, there may be a shame, and then they're ashamed of talking to their doctors, they're ashamed of talking to their family or their friends, and I spend a large portion of my time, at least initially, with my patients, just talking about shame and talking about that it's something that can be overcome or pushed through, and that you can sort of just replace that idea of shame with just another check along your progress in the recovery journey. That's part of it. Return to use, I call it part of the return to recovery. Engaging. Sometimes people have a lot of difficulty just willing to talk to anybody about this problem. So maybe you've become honest with yourself. I have a problem. I'm not willing to become honest with other people just yet. And so sort of just going along that spectrum of trying to get in with somebody. It doesn't need to be a doctor. It could be anybody. It could be Jim or Nathan or any of us here. But then also just knowing what to do. When I was in school, I learned just say no to drugs, and that was it. Not what to do if you are already on drugs. It's like, oh well, you're on drugs. You should have listened in DARE class what to do. I think outlining the specific steps for what people can do, the many different entryways into treatment would be just continue to be massive for anybody who just needs to know what the next steps are. I teach, and again, please interrupt me, I can talk forever. I teach our new trainees SBIRT, which stands for Screening, Brief Intervention, Referral to Treatment or Therapy. And basically it's just a way to check in on your patients, do a screening for a substance use disorder, a brief intervention. It's like, hey, did you know that if you're going to continue drinking, your A1C, your diabetes is going to remain uncontrolled, and that's why you lost a toe. Let's try not to lose another one. Are you ready to slow down or stop? If they say no, say, okay, I may ask you again next time. Let's do it again. And maybe they're not ready to talk because, I brought up their toe that they lost. They're ashamed. But I've had patients that have come back after 4, 5, 6 years, remembering that I offer buprenorphine or methadone or naltrexone or some medication therapy and linkage to services, just knowing that there is an entryway, or just having our providers teach our patients, or being able to teach our providers that there's always the option to come here and not feel ashamed of the treatment. This is part of your medical care. I think that's a good way to get over that first hump of sort of everything I was just talking about.
And, I would add, recovery, and we talked about this earlier, is about healing. It's about not just physical healing, the substance coming out of your system and your body kind of readjusting, but it's about psychological healing, emotional healing, spiritual healing. It's about wellness. And sometimes barriers are created just because of all the stigma associated with substance use disorder that don't tend to follow other medical conditions. So, for example, over the years I've been at Gateway, one of the big things that we reinforce and support is family involvement in treatment. And I've had families say to me, thanks, Jim, for inviting me, but if they loved me, they would have stopped drinking or stopped using years ago. If someone had diabetes or heart disease, a family member wouldn't say, if you loved me, you wouldn't have diabetes or you wouldn't have heart disease. But with this disorder, because it's a disease that affects the brain and the brain's influential in behaviors, people mix that up with choice. And so as providers, it's really important, and we call it disease education, but it's really important not just for patients, but families to understand what this disorder is and how it impacts people's decision-making, how it impacts emotional regulation, how it impacts behaviors. And sometimes that education is something that as providers, we need to do more of. We need to be more involved in helping people understand what this is. And part of that is also using proper terminology. You know, and I think historically in this field, and I want to start by saying, you know, Gateway, we strongly support the 12-step model. However, 12-step is very different than treatment. And a lot of people come into treatment and terminology like addict and alcoholic can plague their understanding of what this illness is and what they struggle with. And I always give the example that, you know, my dad died of prostate cancer 10 years ago, and I get a PSA test every year. If I went into the doctor tomorrow and he reviewed my PSA test and he said, Jim, I have bad news for you, you're cancer, I would first be confused. And then second, be like, what do you mean? How I am not the illness? But in this world, it's been very common to hear you're bipolar, you're an addict, you're an alcoholic. And that terminology, even with good intentions, can create barriers for people to come forward, can create barriers for people to understand this illness from the medical lens in terms of what it is. And most importantly, that it can be treated and that recovery is possible and thousands of people achieve it every day. So there's just so many opportunities to address some of those barriers in a way as providers to help increase access to treatment, improve people's ability to feel like they can manage this disorder, and most importantly, to understand it.
You bring up a good point, Jim. And I wanted to ask about this too, because often when we talk about recovery, we're talking about the person who's experiencing it directly and in their recovery journey. But what are meaningful ways? You mentioned a little bit about, you know, how you pull in family and friends, but what are meaningful ways that family and friends can really get involved to support the recovery of a loved one? And that's open for anybody to answer. Sorry.
Well, you're right. I mentioned a few minutes ago, we call it recovery support education. So we invite families in and we do a lot of work with them and helping them understand, for example, a lot of the things similar to what the patients are experiencing in treatment, because it's really hard if you're a patient, if a family doesn't understand the medication you're on, for example, to support you continuing to take that medication and to be compliant with it. There are many family members, because of that just lack of knowledge, I don't think it's ill intentions in most cases, where they're like, oh, you don't need that, or that's just going to make it worse, and don't understand the benefits of medication, and not only the substance use disorder side, but the mental health side, because we know 80% of clients with a substance use disorder typically have a co-occurring mental health disorder, more commonly depression and anxiety, but we see mood disorders, we can see psychosis, we can see other mental health disorders that really kind of impact similar areas of the brain and can contribute to return to use if they're not managed well. And so it's really important for families to become experts in their loved ones' recovery and discharge planning process so they can support them in being successful on their recovery journey.
Yeah, I'd like to just add in, and that's exactly right, Jim. And, you know, just learning to plan, it's basic stuff, I guess. You know, meeting times, medication schedules, triggers, and simple stuff, you know, avoiding ultimatums, encouraging without controlling, setting healthy boundaries, you know, so supporting the loved one without enabling harmful behavior. These are things that I think for many families are you know, not unusual when there's certain patterns that are set in place. So kind of establishing that that change is really helpful.
You mentioned there's been some discussion, you know, to the point of whole health. It's not just about substance use and sobriety and those types of things. We're really talking about the whole health of the person. And so that makes me also think whole system, right? So it's not just the person providing support or the doctor providing treatment. So why is it important for organizations like your organizations and so many others in the community who maybe don't provide direct services to work together? And who are some of those other stakeholders that you think should be part of this collaboration besides just treatment support and recovery support providers?
I guess I can lead in. I think while we have the same goals and sometimes different means, we often have different abilities or services that we can offer. So I'm a physician. I work in a healthcare facility, and I'm a Cook County employee. And so we try to make sure that we're doing everything that's in the best interest of our patients' health. However, there is certainly a focus within the constraints that we have on medication and medication treatment and access. That's just our perspective as medical doctors. Though I don't think that we would be a complete healthcare system if we didn't have our partners to work with. So we may get referrals from our friends here in this meeting who need their patients to get some medications and get it quickly. And we may have some patients that desperately are in need of a more intensive outpatient or even inpatient level of care that we don't necessarily provide here in Cook County or within the constraints of, a 20 or 30-minute doctor visit or an hour-long visit, however long it is. And while we can provide some social support and services, we know that many of our colleagues can do some of these things better with greater speed or with a little bit more attention than we may be able to go to work with. And really, it's a symphony. It's not a solo.
Yeah, I agree. I mean, I think at this point, as we see patients enter into treatment at Gateway, we not only see an increase in severity around substance use and mental health disorders since COVID, but we also see an increase in needs for housing, for medical support, for job coaching and employment skills. And so really those community-based partnerships, especially in Cook County, are just so crucial to individuals being successful in recovery, because you can come up with a really comprehensive, solid plan around medications and around treatment. But if those other life domains aren't addressed, it's very difficult to be successful.
Yeah, I'd also just like to echo on what you said. No one program can meet all needs. So, it's important for coordination to take place for that reason. But, also because the shared outcomes, the shared data, I think it helps us learn what works. Without that, we're just, we're less empowered on what's working. I think coordinating care helps with retention, and it helps build trust with folks.
Those are great examples of the importance of coordination and how it's not just on that particular individual to take on full responsibility, but to lean on supports at different times and understand those supports come from different places that you may not have known. And that kind of leads me to thinking there's so many different places you could go or talk about this, but when you throw in the things discussed around shame and stigma and expectations that are old and the way that the thought process goes, how can somebody know that they are ready to begin their recovery journey? And what are the steps they can take? How do they go about finding those services and supports that work for them?
Well, I would just start by saying that sometimes it can be overwhelming, and really to normalize how overwhelming it is initially when you're struggling with a substance use disorder, to feel like, hey, I can do this, or this isn't who I am, and how important it is if you're experiencing negative consequences of any kind as a result of that, whether that be physical or relational or even legal, to reach out and get support and help. And I think the good news is, especially in Cook County, there are so many community partners and services and supports available to people, and treatment is readily accessible, more so than it's ever been in the past, especially access to medications now than it has ever been in the past. And so just taking that first step, and, at Gateway Foundation, as well as community partners across Cook County, there is websites you can access information on a lot. There's a 24-hour helpline that not only agencies have, but the community now has, to just take those first steps to ask those questions and say, hey, I'm not sure if treatment or recovery is going to work for me, but being able to just reach out and have those initial conversations really is the first step. And to know that you're not alone. That's the other piece I would add. You are not alone. What you're experiencing is manageable, and what you're experiencing does not have to be your baseline.
I'd like to just add that for us as providers, just to be aware that, like readiness doesn't have to look like readiness, or what, is the stereotype of what readiness might look like. It can look like curiosity. It can actually just look like ambivalence, and so, I mean, that's where the meeting the individual where they're at component of this becomes skillful and has to be done skillfully and is so relevant. And I would just say for folks, how can someone know how do they find a program? It's just looking for a fit with really practical criteria like schedule and location and cultural alignment, things like that. They will improve outcomes for the individual. Those criteria.
I think understanding that recovery, again, that it doesn't mean abstinence is good. But I think that once a person has initiated self-reflection on their own or either with the assistance of somebody else, I think recovery has already begun. And so you no longer need to say, how do I get started with recovery? It's how do I continue and accelerate my recovery? Doesn't mean it needs to go fast. It can go at their own pace, but it just means how do I get to my next step? I'm biased. I'm a physician. I know that not everybody goes to see a doctor. They probably should every now and then, but a healthcare professional, any healthcare professional, has a duty or obligation to make sure they help you. So whether it's a primary care doctor, whether you stubbed your toe and you're in the urgent care or emergency department, these are all people you can just ask. You should not face any judgment. And if you do, please let somebody else know because they shouldn't. But there should be no judgment, and you should be able to get in a Google search, or a non-branded search, some search. Go on Facebook. You're on Facebook now. The internet has a lot of dangers just by searching for anything. But you're going to see people, there's going to be search terms. There's going to be a lot of organizations that want you to get well or be well or stay well, and explore them all. This may be the point where I put in a plug for a Bridge Clinic. Just Google Bridge Clinic, Cook County Health Bridge Clinic, or just find a primary care doctor. And that's a good way to do it. You don't even need to talk to the doctor. You can talk to a medical assistant or nurse, or when you're just at the very beginning, just make sure you bring it up, and we'll get there.
The other thing I wanted to add as I was listening to my peers speak about this is recovery. Sometimes people are hesitant to reach out because they think, okay, I can't commit to a residential program right now, for example. But recovery and levels of treatment now are so much more diverse than they've ever been. You could get into a virtual program and meet with a doctor or meet with a counselor. And for some people, that will be sufficient. For others, they'll need more. But the reality is just getting started does not necessarily have to mean I have to make this big commitment, because some people are worried about I can't, stop working right now, or I can't be away from my family. Recovery and treatment doesn't mean that has to be the case. And so just, reaching out and taking those initial steps, looking at what resources treatment centers offer in terms of levels of care and treatment options, and finding one that's best for you, and asking questions, as mentioned earlier. All of us have 24-hour or helplines or websites. I'll do my plug, gatewayfoundation.org. It'll give you information, but across the community, there's opportunities to do that. And in the day and age we're in now, it's easier than ever to access information on services and treatment.
I'll add that Cook County Health, we will often make a recommendation for a higher level of care, but just as Jim was saying, we're all humans. We survive by having jobs. We look after our children. We make sure our bills are paid. And one of the things we'll often emphasize here is that you should be able to engage in recovery or medication treatment and not have to interrupt your life whatsoever. And that's one of the benefits of some of the medications that we'll be able to provide, such as buprenorphine, where it doesn't need to be dispensed at a specialty clinic at 4 a.m. Or whatever it is. Like, you don't need to go every single day. You can get up to, usually we'll give a week of medication just to get started and sort of get your act together and maybe build up the courage to get it, because the day you have the appointment may not be the day that you actually want to start taking a medication for recovery. You may need some time to arrange your schedule, prepare to maybe withdraw a little bit with the help of some medications, and maybe you need some childcare while that's happening. We want to make sure that you have every opportunity to do that. And if you're doing well in recovery, we like to reward people and make sure that they can get a longer prescription. So maybe after a few months of recovery, if you're doing well, we'll give you a month at a time, or 2 months at a time, or even 3 months of medication at a time. Because the goal here is to make sure that you live your life, not that you live your life in a doctor's office pleading for prescriptions. We want to give you the tools to be able to do this with as little interruption as possible.
I love all of what you're saying. It's, individuals are unique, but their experiences may not be, in terms of understanding the universality or the normalization of needing some sort of help, and knowing that could look very different from person to person to person based on what that individual needs, which leads into our final question. Just if you could briefly just say what's one piece of hope or encouragement you would give to someone who is just starting or already on their path to recovery?
I would say, first and foremost, to know that recovery is real and recovery is possible and recovery is within your reach. And I think for a lot of individuals, those statements seem counterintuitive to what they're experiencing in the moment. And, if I could put my clinician hat on for just a minute, I've told patients over the years many times, addiction is a thief. It robs you of your identity. It robs you of believing what your potential is. And none of that is true. But initially, it can feel that way. And so just to understand, this is something just like other medical conditions that can be managed. And most importantly, this is not who you are. And to get to where you want to be and to where you should be, taking those first steps to get assistance, support, treatment will help you not only in your recovery journey, but in your overall quality of life.
Yeah, I'd just like to say, recovery is more than just stopping something. It's starting a life with purpose. Having that purpose and meaning, I think, is the key to long-term engagement. A reason to continue on, a reason to stay on the path. And I say it's done through small wins, just stacked up daily.
I have, I think, 2 main points, aside from the one I mentioned earlier about shame and sticking with it. But one, be prepared to listen. I do have some people that come in and they're happy to tell their piece, which I'm happy to listen and understand their piece, but then they just sort of want to say their thoughts and leave and not really engage. But if you're coming to seek advice from experts, listen to these experts. We don't mean you harm. We want you to do well, and we have plenty of experience. But also, keep going. My son is a ice hockey player, and his coach told him during practice, if you are not slipping and falling, you're not trying hard enough to learn how to skate like a hockey player. And so don't let something small trip you up, if you do get tripped up, just get right back up. You're going to be stronger for it. And so stick with it.
Thank you so much to each of you, Dr. Burkhead, Nathan, Jim. It's been really helpful to hear about your experiences and the insights you bring from the really inspirational and I know impactful work that you're doing with your organizations and in the communities that you work. I'm pretty sure we just scratched the surface of a lot of these topics and a lot of the different resources that are available. We'll be linking different resources that are available in the chat. And thank you to everybody for being a part of this conversation. It's very exciting. It's a privilege to be able to host the conversation on this very important topic. So whether you're looking to start your own recovery journey, whether you've already begun that journey, you're looking to help somebody you love, or you're just looking for some additional information, it's as easy as taking the first step. There's so many different places to reach out and so many different resources available. So at Cook County Health, we have many resources and many ways of connecting you to the support you need. So please visit cookcountyhealth.org/MAT for more information. And again, thank you very much to our panelists. Thank you very much to everybody who joined us today to listen to and support this very important topic during National Recovery Month. Thank you.
Thank you.
Thank you. Great chatting.
Thank you, Greg.